Myself, Bharathi Ganguly, रिटायर्ड प्रिंसिपल फ्रॉम बोकारो जनरल हॉस्पिटल। मैंने बहुत जगह चेकअप कराए थे हॉस्पिटल में। आई एम हैविंग प्रॉब्लम शॉर्टनेस ऑफ ब्रेथ एंड चेस्ट पेन oftenly. Sometimes if I sit also, that time also I am having breathlessness. I have checked all the time hospitals, more or less hospital, but I didn't get exact result. Now I came here in Apollo Hospital, and where I get all the doctors and staffs. They behave very nicely. They are caring nature, and all are efficient. Very nice, the staff. Result is very good. And like this Apollo Hospital also, all the staffing member, everyone is very nicely.
I am Anushka and she is my mother. I came with her here at Apollo Hospital to get her treatment for HCM. That was diagnosed many years ago, but proper medicines and proper treatment we didn't get. So I thought to choose Apollo and see the doctors here. I also went to many other hospitals and I got treatment, but it was not satisfactory. Then I met Dr. Somin Devidat here, and he was very prompt and very active in treating her. In less than 2 days, he diagnosed and also gave the proper procedure, which also led to us requiring an ICD, which was implanted in less than an hour, which is very expertise that Dr. Somin has, and he did the procedure. He talked to us very humbly and explained every single detail that I asked, that I prior researched and came and researched, and he answered me very humbly and every single question, and he is a very ethical, very good doctor, and I wish him he raises many heights. And also the hospital staff and everyone here is very polite, very humble, and taking very good care of my mother. And I wish all the best to all the team of Apollo, and thank you for helping us out.
Hello, warm regards to our viewers. I'm Dr. Somin again. I'm a cardiac electrophysiologist and heart failure specialist from Apollo Hospitals, Hyderabad. It gives me immense pleasure to state about my interaction with Mrs. Bharathi Ganguly, who came to us recently from a far state of Jharkhand. In short, she was suffering for a very long time with hypertrophic obstructive cardiomyopathy, as many of the viewers would probably know. It is genetically transmitted illness of heart muscle, wherein simplistically said, the heart muscle becomes very awkwardly thickened and malfunctioning. Please refer to our video separately on hypertrophic obstructive cardiomyopathy to learn about the ways it manifests, the disease spectrum and its treatments. Talking about Mrs. Ganguly, she was suffering tremendously with a very poor quality of life, with severe fatigue, breathlessness and chest pain, even with trivial exertion, and it was significantly hampering her day-to-day life. She herself is a senior nurse and was really devastated with these complaints for more than a decade. She went to many centers without a satisfactory relief in her symptoms, and we really thought that now, fortunately, we have a great medicine to our access these days, specifically for hypertrophic obstructive cardiomyopathy, and we decided to start her on that, and she really has responded well to the treatment. Further, hypertrophic cardiomyopathy is associated with a risk of sudden cardiac arrest, and for that we did an EP study, electrophysiology study on her, which did induce a sudden cardiac arrest in the cath lab, and thereby projected the risk of sudden arrest outside the hospital in future, and that's why she was implanted electively with a defibrillator the next day, and that would protect her from a sudden tragic event in her life which she is prone to. Wish her all the very best and a great quality of life. To know more about hypertrophic cardiomyopathy, like I said, please refer to the video that we have uploaded specifically on hypertrophic cardiomyopathy, and do not hesitate to meet us in our arrhythmia clinic in Apollo Hospitals, Jubilee Hills. Thank you.